16 if we extend. Yeah. So nutrition in HIV, we are basically going to discuss how you can be able to manage a HIV positive person or those who are affected. Remember, there is a difference between those people who are infected and those who are affected. Those who are infected, they are those who are carrying the virus, and then those who are affected, they are the people who are living with those people suffering. Yeah. Yeah. So basically, in our first topic, we are supposed to go through the introduction to HIV and AIDS. I hope that you have gone through HIV and AIDS as a unit. And in this case, you covered the HIV progression, as in how can HIV be able to progress from the first stage to the last stage, which is the full-blown AIDS. But in this case, in our HIV progression, we will discuss the three main stages, how you can be able to manage it as a nutritionist, and that is the key area that I want us to discuss today. Yeah, so let me cover the course outline very fast. The second topic is supposed to be nutrition, HIV, and AIDS. That is the relationship between nutrition and HIV infection. How do they affect each other? And you'll be able to see that. Then we have the nutrition in HIV infection. That is, you need to understand the nutrient requirement or the nutrients that a HIV AIDS suffering person require and how you can be able to meet them nutritionally. And that is through diet. Then the food security in HIV affected households. So this is whereby now you need to determine, is the breadwinner the one who is affected? You know, if the breadwinner is the one who's suffering, it means that that household can be critically affected in terms of the food, the acquiring of the food, and so on. So how can you ensure that that household will be food secure? They won't suffer from the food insecurity, whereby they can go a day without food. So basically, we'll cover the nutrition interventions and the socioeconomic implications of HIV in relation to nutrition, how socially those people can be affected. And remember, here it's all about how you can improve the food security of those who are suffering. Then we will also cover infant and young child feeding in HIV and AIDS. That is, we need to know how you can be able to feed a child who is suffering from HIV and AIDS. So in this case, in the hospitals, you find that these children, they are taken to an area referred to as PMTCT, the prevention of mother to child transmission. This is whereby the pregnant women, those who are suffering from HIV, they visit that clinic. They don't go to the normal CWC, the child welfare clinic, or the normal antenatal clinic. Wanaendanga kwa the PMTCT area. That is where they are able to, as in the clinicians there, they are able to protect them from, as in they are able to protect the HIV transmission from the mother to the child, either during pregnancy or either when they are breastfeeding. So in this case, the key area is about how do you feed your infant? How do you feed your child? Remember, who is an infant? An infant is a child who is below 1 year. Then from there, we have a young child, or we have a toddler, and so on. Those one we'll discuss them later in the nutrition throughout the life cycle. Then we have the opportunistic infections. So in this case, these opportunistic infections, they are the ones which make those HIV positive, as in to go to their last stage. So in this case, if they are managed well, for example, if a TB is managed well, it means that disease won't make this person to be very, very weak. So there is many opportunistic infections such as meningitis, they have TB, and even pneumonia, and so many other diseases which are opportunistic. And basically, these opportunistic infections, they are the ones which make a person to progress. Remember, a person progress from HIV to AIDS. You can have the virus, but you don't have AIDS. Hoping you can tell the difference from the HIV and AIDS unit. Then we will also discuss the ARVs, the antiretroviral drugs and nutrition, because we have some key precautions which these patients are supposed to take, especially when they are taking the medicines. As in, we have some food which they need to avoid, and others they need to ensure that they eat them to ensure the efficacy of the drug. Then we will also cover the nutrition care process, how you can be able to manage a person from the time they get to the hospital to the time they leave, and to ensure that they are very, very satisfied. Then the monitoring and evaluation. How do you monitor them? and evaluate. You know, monitoring, for example, in this case, they need to have a follow-up visit. When they are coming back for the medication, also as a nutritionist, you need to see them. So you need to know what really do you need to check. Then the evaluation, you need to tell whether there is improvement in their condition. Yeah, so that is basically on the course outline. Let me share the other notes. Is there any question? Hello?
Yes.
Is there any question so far?
No.
Okay, so you can understand.
Yeah.
Okay. So today, let us briefly, on the introduction part, I am tending to skip this because I believe you have really covered in details. That is true. So you covered HIV and AIDS.
Yeah.
Yes, so
Yes.
I won't cover much on HIV and AIDS. I won't go into details because there is a lot that we need to cover. And remember, we have limited time. So basically, you need to understand what is the meaning of the word HIV, AIDS, and so on. So remember, like I said, there is the progression from HIV to AIDS. As in, a person can have a virus but not AIDS. So that is two things that you need to note. AIDS is the last stage whereby a person is almost like the person's body immunity is very, very affected. They have opportunistic infections and so on. So we have another term, the ART. ARV, that is the same thing. ART, it's basically the antiretroviral therapy. I hope you can understand that the therapy, it's now the whole process of taking those drugs and ensuring that this person is compliant. It's compliant and there is no default cases in the follow-up. That is the whole therapy case. And this reduces the rate at which the virus replicates itself within the cell, delaying the progression of HIV to AIDS. So the other term you have come across them, malnutrition, nutrients. You take food, but the body absorbs nutrient. The nutrition status very key when you're managing a HIV positive person. You need to be able to tell where they lie, such that you can be able to decide the best nutrition intervention. Then the opportunistic infections, there are very many, hoping you can name some of them. So let me go direct to what I wanted to cover today, the stages of HIV progression. This is key area, and that is why I've decided to take it to Zoom so that you can understand, hoping you can be able to see my screen. Can you see my screen? The stages, eh?
Yeah.
Stages of
Yeah.
HIV progression to AIDS. Let me check whether Anne is with us. Yes, okay. Anne, how are you? Hello, Anne?
Yeah.
Okay. So you are with us, eh? Okay, welcome. So the stages of HIV progression to AIDS. So in nutrition, I want us to cover the three main stages. I believe in HIV and AIDS, you covered very many stages. See, that is true. About five stages. But in this case, I want to go direct to the area where you need to act as a nutritionist. So in this case, we start with the asymptomatic stage. This is whereby there is someone with a lot of background noises. You can mute your speaker so that we can communicate. Mute your speaker. Mute. I didn't need you to understand this area. Deborah, mute. Okay, let's continue. So on the asymptomatic stage, this is where you find that a person weight loss is less than 5%. As in, they have lost some weight, but it is less than 5%. So in this case, you're supposed to increase the energy requirement 10% more. What do you mean by this? And there is a lot of background noises. And unmute your speaker. And you listen. Remember, we can hear you when you speak and you have not unmuted your speaker, or you can hear the background noises. So I want us to save time. I want to conclude this lesson in the next 10 minutes. Yeah, so I was talking about the asymptomatic stage. So the weight loss is less than 5%. Hoping you can I believe you understand mathematics. So we, by 5%, we mean that if a person was 50 kgs normal weight, and a person is coming and telling you, like now you're weighing and you find that they are around 45 kgs, but this person is telling you, normally I'm usually at 50 kgs. So how can you tell it's a 5%? So you find 5 times 50%, the normal weight. So in this case, 5 times 5%, 50, that will give you 5/100 times 50. How many kgs are those? It's about 2.5, right? I don't know whether you have done those mathematics. It's supposed to be 5/100 times 50. So you cancel the zeros, so we have to, it is 2.5 kgs. So this is where you find that if a person normal weight was 50 kgs, they are less than, as in, you find that they maybe they are at 48, 47 kgs now, like the current weight is 47 kgs. That means it is less than 5%, or it's about 5%. So you're supposed to increase the energy requirement by 10%. Why are you increasing the energy requirement? To prevent this person, as in this weight of this person, to continue going down. 10% more of the energy. What do we mean by this? You're supposed to do the calculation. I don't know whether you have somewhere you can write. Like, let's say, for example, a person, normal nutrient requirement was 2,000 kilocalories. If it was 2,000 kilocalories, hoping you are writing, a person normal nutrient requirement was 2,000. So you find the 10% of 2,000. So 10/100 times 2,000. That will give you, that is 20 times 10. That is 200 kilocalories. Hoping you have done that math. 10% of 2,000. That will give you 200 kilocalories. Then, since the normal nutrient requirement was 2,000, now this person who is at the asymptomatic stage is supposed to be eating 2,000 plus 200. That would give us 2,200. And now the 2,200 kilocalories, this is what you're supposed to use to maybe come up with a diet plan. I believe some of us, we have not covered how to come up with a diet plan. That one, we'll discuss them later in Diet Therapy 1, maybe next semester. So the Therapy 1, we will discuss the diet, how you're supposed to come up with a diet plan. Later on, and how also you determine the normal nutrient requirements of a person. So these are very key things. You need to determine first the weight, and then the weight can tell you how much are you supposed to increase on the energy. The others, they're about the general characteristics. So the other characteristic is that largely they are not related symptoms, except in the first few weeks. Then we have the generalized lymph glands enlargement. So in this case, you can find that person is complaining of tonsils and so on. Then the immune system is weakening, and recurrent upper respiratory tract infection, the sore throat, there is the common cold, coughing, and so on. And the individual does normal activity. Those are basically the normal characteristics, which I believe you covered in nutrition in HIV. Then we have early symptomatic stage. Early symptomatic stage. So in this case, the weight loss is greater than 10%. So remember the case of 50. So if that person, the normal weight was 50 kgs, 10%, it means it is 10/100 of 50 times 50. This will give us 5 kgs. Meaning, if a person normal weight was 50, if a person normal weight was 50 kgs, it means now their current weight is about 40. Meaning their weight is going down at a very high rate, and this person is at a early symptomatic stage. And in this case, the energy requirement, hello?
Hello?
You can hear me?
Yeah.
Oh, okay. I thought we are not together. Okay, anyway, let's continue. So the energy requirement is 20%. So this is 20% of, so remember how we did the calculation on the asymptomatic stage?
It is 20/100 times
2,000. So if it's a normal requirement, if the normal requirement is 2,000, you'll find 20/100 times 2,000. That will give you 400, right?
Yes.
Yes, so it means now this person, if that person is at this stage, it will be 2400 kilocalories, and that is what you use to do the calculation. So then in the full-blown AIDS, you see now the person weight loss is greater than 10%. It is way much. It is way much than in there. So if a person normal weight was 50, you find that they are even less than 40. They are less than 40 kgs. And now the energy requirement now is about 30% more. So you see the energy requirement is increasing depending with the stage of the infection. Are we together?
Yes.
Yes, so that is key thing that you need to note. So the other characteristics I have opted to left them out because I believe you can understand that. Is there a characteristic you cannot understand? So in the early symptomatic, we have early opportunistic infections, the mucous membrane and the skin infections. So you find that they may be having candidiasis, either. So this is where you find that they even have the rash that is on the throat or in the mouth. Or even remember candidiasis also affect the urinary tract, either in the vagina, if it's a man, in the urethra, and so on. Then the normal or partial physical activity, you find that most of the time these people can be in the hospital or even bedridden. So you find that their work capacity is lowered. But the good thing is that currently we have the ARVs, which made it easier for in the management of the HIV and AIDS. Because okay, if a person is not defaulting the intake of those drugs, they cannot be. You find that they cannot easily progress to the full-blown AIDS. That is true. Have you ever seen a HIV positive person?
Yes.
And they are not dying like kitambos. That is true.
Yeah.
It is managed, in short, as in the where we are right now. It's not where we were around 2000. I believe some of you are very retro that time, or you were not even born during 2000. Were you born? Okay, you didn't know yourself
Yes.
well, some of you. So that was very worse. Around between 2000 and 2005, as in the HIV that time, really affected people. And that is when you found that even the breadwinner in a house can't provide. It means those people, they are very affected. There are very many NGOs which were there to assist, and they really assisted in the provision of even food to this household. But also, even now, we are still discussing the same, because this is a disease that is that doesn't have cure. That is key thing. It doesn't have cure. And the transmission rate also, it was very high, but it was managed later on. Yeah, so that's it for today. That is what I wanted us to discuss. Then there is also key thing. Since we are on Zoom, you can also see this cycle. There is this cycle, the malnutrition and HIV cycle. These are notes which I'll upload later. Can you be able to see my screen? Can you see my
Yes.
screen?
Yes.
Yes, okay, so there is this cycle. I would like you to really understand it. So we have the malnutrition and HIV cycle. So at the center here, we have the HIV infection. How can HIV infection affect? As in, we have different areas that it can affect. As in, for example, let's start with here at the top. We have the poor nutrition status. A person who has infections, basically they have poor nutrition status. That is, there is weight loss, there is muscle wasting. Weight loss, as in, if weight loss is not controlled, it progresses to wasting, whereby you find that a person is really losing the muscles. As in even their skin, the skin, they start to sag, like it starts to appear like an old person. Hoping you can tell the skin of an old person. So that is how the skin starts sagging, and that is as a result of muscle wasting. Then there is weakness and micronutrient deficiency, because most of the micronutrients, they are lost. Maybe when they are vomiting, they are diarrheaing, or maybe they are not even able to eat food because of nausea, vomiting, and also cases of whereby they may be having mouth sores such that they cannot be able to eat food. So you find that most of the nutrients are lost. And then from there, this poor nutrition status translates to impaired immune system. And this means they have poor ability to fight HIV and other infections. So this is, you see, it's becoming worse. Meaning now there is increased vulnerability to infections. The opportunistic infections come in. Coughing, TB, then there is it can be even meningitis, the cryptococcal meningitis. You find that most of the bedridden or those hospitalized HIV patients, they are either having TB or cryptococcal meningitis. Meningitis, they are of two types. It can be caused by fungus, it can be caused by bacteria. So there is the normal meningitis that can affect a normal person, that is bacterial. But for HIV, it is usually cryptococcal. Cryptococcal is a bacteria. We will discuss more on that on the opportunistic topic, opportunistic infections topic. And this means this person is almost progressing
What
to
about
AIDS.
blood pressure, madam?
Yes, you have a question? Our time is
What
up.
about blood pressure? Is it?
No. Blood pressure is not an opportunistic infection. So lastly, there is increased nutrient needs. So this is it, you see there was an increment in the energy as a person progressed from one stage to another, and it also means they are supposed to have increased food intake, of which they don't achieve it because of very many signs and symptoms. And we will see how you can be able to manage, or how you can be able to assist a person to manage those signs and symptoms. So our time is almost up. Is there any question?
No.
Yeah, so that's all for today. That's all for today. You can continue summarizing notes. There is some notes which I posted there, starting from the introduction. But I believe this cycle is not there. I will add them before the end of the day. So if there is no question, you can have a good day.
Okay, you too.